Hi, Dr. Vo here. I'm a cataract and refractive eye surgeon. If you're thinking about having cataract surgery, then you probably know that you'll need to decide what intraocular lens implant you want to get. Most people will choose their lens based on four broad categories. These are the monofocal lenses, toric lenses, the extended depth of focus lenses, also known as EDOF, and the multifocal lenses. However, even within these categories, there are so many choices to choose from. In today's video, I'm going to review the Eyhance lens, which is an advanced monofocal lens made by Johnson & Johnson. The TECNIS Eyhance was first released by Johnson & Johnson in 2019 and had US FDA approval in 2021. The lens filled a unique position in the market. It offered more intermediate vision than a standard monofocal lens, but not more than an EDOF lens such as the Vivity lens by Alcon, or than a multifocal lens such as the PanOptix. Instead, the Eyhance was marketed as an advanced monofocal, or you may see the terms enhanced monofocal or monofocal plus. Let's briefly review how monofocal lenses and extended depth of focus lenses perform to see where the Eyhance lens fits. Monofocal lenses, sometimes called a standard, basic, or traditional lenses, are lenses which have a single focal point. This means that while the lens can provide clear vision at a single distance, it's limited in terms of the depth of vision it provides. Most patients choose to have their distance vision corrected and wear reading glasses for intermediate and near vision. These lenses are great because they provide excellent distance vision with minimal side effects in terms of glare and halos, and also have excellent contrast sensitivity. In contrast, the extended depth focus lenses, such as the Vivity, extend and stretch light to create a longer focal point. As a result, these lenses are able to provide excellent distance vision, but also good intermediate vision. This allows patients to decrease their reliance on reading glasses that one would expect from standard monofocal lenses. If your goal is to be less reliant on your spectacles, then an EDOF lens would be an excellent choice. Or alternatively, you could opt for a multifocal lens, which would offer an even wider range in vision than the EDOF lenses. However, the main drawback for lenses like the EDOF and multifocals is that there is risk for glare and halos. Contrast sensitivity can also be reduced. This can become an issue for patients in dim or low light settings, such as when driving at night. So, where does the Eyhance lens fit into this then? The Eyhance has a single focal point like a standard monofocal lens. To provide more intermediate vision, the center of the lens has higher power, thereby increasing its depth of focus. The Eyhance is able to offer more intermediate vision than its standard monofocal lens counterpart, while still maintaining the excellent contrast sensitivity and minimal risk for glare and halos. Johnson & Johnson reports about a one-line improvement in intermediate vision when comparing the Eyhance to a standard monofocal lens. However, don't expect it to provide the intermediate or near vision that you would get with an EDOF or multifocal lens. For my patients who choose to get the Eyhance, I tell them that they should still expect to need their reading glasses afterwards. So let's review what are the pros of the Eyhance. Number one, it offers excellent distance vision. This lens is perfect for things like driving, playing golf, and day-to-day life. It gives distance vision that is comparable to most standard monofocal lenses. Number two, there's improved intermediate vision. For tasks at the intermediate range, such as using your computer, cooking, or reading the menu, you might find you are less reliant on your reading glasses, but you definitely will still need them, so keep them on hand. Number three, minimal halos and glare. Compared to multifocal lenses and EDOF lenses, the Eyhance will produce far fewer visual disturbances, especially when driving at night. Number four, it's an excellent option for all patients. While certain conditions such as glaucoma, macular degeneration, or a history of laser eye surgery may make you a poor candidate for a multifocal or EDOF lens, the Eyhance will still be a good option. While the Eyhance offers many advantages, it's not a perfect lens. It still has its own limitations. Here are some of the most important ones to remember. Number one, you will still need your reading glasses. The Eyhance does not meet the requirements to be labeled as an EDOF or multifocal lens. It does not have the diffractive rings that a multifocal lens uses, and does not increase the depth of focus to the extent that an EDOF lens would. So we need to be realistic and understand that the Eyhance will not get you out of glasses completely, even at the intermediate range. If your goal after surgery is to be less reliant or spectacle independent, then this lens is not for you. Number 2, it may be difficult to find the Eyhance. Standard monofocal lenses are covered by insurance. Although the Eyhance is technically classified as a monofocal lens, the lens does cost more than a standard monofocal lens. As such, many practices may not offer the Eyhance or will only offer the Eyhance as part of an upgraded package, such as including the use of the lens if the patient chooses to have laser-assisted cataract surgery or if you choose to have astigmatism correction. Usually this fee will still be cheaper than upgrading to a multifocal or extended depth of focus lens. So, in summary, would I recommend the Eyhance? The answer is yes. The Eyhance lens is an excellent option if you want really sharp and crisp distance vision while having some improvement at the intermediate range as well. It won't get you out of reading glasses the same way a multifocal or EDOF lens would, but you won't have to worry about the glares and halos and decreased contrast sensitivity you might experience with those premium lenses. Overall, the Eyhance is a great lens and one that I routinely implant in my practice. If you're considering cataract surgery, talk with your surgeon about your goals and whether the Eyhance fits your lifestyle needs. Thanks for watching. If you would like to learn more about the different cataract lens options available, please check out my complete guide to cataract lens options, which I'll have linked on the screen. And if you found this video helpful, please make sure to like and subscribe, and I'll see you in the next video. Take care. Bye.